transition also. But on the other hand, we also realize that the risk of biological disasters is increasing day by day. So we were already within this pandemic, and we had other kind of biological risk coming and going. We had the risk of chikungunya, we had the risk of dengue, we had the risk other biological diseases risk, and recently the bird flu. So that also had added to the risk. So and beside this, this coronavirus itself has been notorious in terms of its capacity to mutate. So there will be some questions that will remain unanswered at present, and that gives us some idea to be prepared for the new complexities in the future also. As we are not aware that the new mutant are the new biological risk of disasters, maybe pathogenic disaster, maybe bacteriological disasters, are the viral attack, and then a kind of new pandemics also in future, because this pandemic has also shown that an epidemic can turn into pandemic, because now the world is really become a kind of a global village. There's a lot of mobility. People are moving very fast without even we are able to notice any kind of a possibility of disease spread. By the time we come to know, by the time that so many people have already traveled to far off distances. So that has been an important attribute in that has in this coronavirus pandemic also. And regarding this new variant, that was a UK variant, the time we realized that it is a new variant, it has already spread to several other countries. So these are the kind of new dimensions which are emerging. So today we will be also discussing the future risk issues also, but also would be sharing the highlights of the book that has been published, where Professor Santosh Kumar, Dr. Manish, and many other participants also, including Professor Ruben Kishorsa, they have contributed to various chapters also. So with this, I welcome all the speakers, our partner Springer Nature, Dr. Akansha, and all the participants at this in this discourse. Over to you, Fatima.
Thank you so much, sir. Thank you for welcoming all our panelists. So now, since Professor Major General Manoj Kumar Bindra sir is busy in other meetings, so we will just start our panel discussion. So I'll just request Dr. Manish Kumar Goyal sir. But before requesting him, I'll just give a brief about him. Dr. Manish Kumar Goyal is Associate Professor in the discipline of Civil Engineering, Institute of Technology, Indore. He is one of the top 20% scientists in the world, prepared by Stanford University, also in the top 500, the leading researcher in the field of environment engineering, meteorology, and atmospheric science. His research interests include water resources engineering, GIS, and remote sensing applications in the water and environment and climate change. He received B.Tech degree in Civil Engineering from National Institute of Technology, Warangal, with a distinction with M.Tech degree from Indian Institute of Technology, Roorkee. After a brief stint in corporate, he pursued PhD degree at IIT Roorkee in collaboration with University of Waterloo, Canada. He went to pursue further research as a postdoctoral fellow at Science Technology University, Singapore at McGill University. Dr. Goyal has I index and H index equal to 46 and 22 respectively, with total citation at 1639. He holds more than 1,000 publications on different domains of GIS and remote sensing, water resource, climate change, hydrological and hydrodynamic modeling, snow and glacier melt, soil carbon sequestration, anthropogenic change, risk and resilience. He serves as an associate editor for the ASC Journal of Hazards, Toxic and Radioactive Waste. He recently edited a book on sustainability, fundamentals and application with John Wiley and Sons, with contribution from subjects experts from over 100 countries. He received overwhelming response from the worldwide. His contribution fetched him a recipient of American Society of Civil Engineers, Environmental and Water Resource Institute, visiting international fellowships. Professor R.J. Garde Research Award, Indian Society of Hydraulics 2090, recipient of American Society of Civil Engineering. Best Theoretical Orient Paper Award 2018, and IPIDA GPU Research Grant 2018, IEA Young Engineers Research Award in Civil Engineering Division 2017 to 18, Indo-US War Fellowship Award 2016, DST SERB Young Scientist for Trek Grant 2015, Inspired Faculty Award 2014, and Canadian Commonwealth Scholarship Award. Dr. Manish Kumar Goyal, sir, please.
Thank you, Fatima, for nice introduction. Could you please allow me to share my presentation? Okay, thanks. Okay, so I hope now everybody can see the presentation.
Yes, sir.
So,
Yeah.
okay, yeah. I would like to thank Professor Anil Gupta, NIDM. I think he is the pivotal in organizing this conference, and also Dr. Akanksha Thangi from Springer Nature. So thank you very much, NIDM and Springer Nature, to coming out with this webinar on living with coronavirus 2020 and beyond. Okay, as mentioned by Professor Gupta, this COVID-19 was proclaimed as a pandemic, I think sometime in March first week or March 11th, 2020 as a pandemic. After that, next 2.5 months or next 3 months was a lockdown. Totally, more than half of the world population was under lockdown, economic depressions, and many other things have happened. And this was continued till July and August. So, sometime in July and August, I discussed with Professor Gupta that since we are in the lockdown and everything is we can't do anything, so how we can take this opportunity and how we can bring out some kind of gaps they are there in this pandemic world to have an societal impact, environmental impact, economical impact of this virus outbreaks. So to fulfill these gaps, we got an idea, and I discussed with Professor Gupta a couple of times, and then we decided the table of content, and then we have gone ahead to various authors, and then we came out with this book, Integrated Risk of Pandemic COVID-19: Impact, Resilience, and Recommendations. So basically, this book proposes a integrated approach by which the impact of this COVID-19 outbreaks can be assessed more effectively. It will also help the government of India and other organizations in the policy making and decision planning to handle such kind of situations which world has never seen, such kind of pandemic. So basically, this book has 24 chapters, and they have been divided into the 4 parts. First one is the review of the fundamentals of the virus outbreaks, where we have taken the past pandemics, we have reviewed them, and the threat of these pandemics to the societies and the nature that we have discussed in the chapters of part 1. In the part 2, integrated impact and risk of virus outbreaks, we have discussed on various aspects from environment, agriculture, air pollution, economy, food industry, and transportation sector. Additionally, what are the governance challenges globally faced in this pandemic? That also we have described in the second part of this book. In the third part, that's very important, and what are the roles of various measures and resilience? Basically, in terms of public health interventions, technological advances, and use of different technologies such as nanotechnologies or others in the healthcare system that we have described here. And finally, fourth one, what are the lessons and recommendations while dealing with such kind of pandemics? What are the lessons we have learned across the developing world and the developed world that we have tried to cover in this aspects? And authors we have taken from across the globes, from developed countries, from developing countries. They have a very wide variety of backgrounds and experience in dealing with such pandemics in historical times and these health crisis times. So approximately in this book, we have 72 authors with 24 chapters, and there are 31 institutes across the globes, and there are 10 countries involved in this book. So this is a kind of a general overview of this book. Additionally, that I just mentioned you the psychological between disease, healthcare providers, government and pollutions. Since myself was a COVID patient during July 2019, July 2020, even earlier. So I was also be the one of the victim, and what are the things that I have felt that I also discussed. So COVID-19 coming to the combat of the outbreaks. So in terms of government rules and regulations, there's a lockdown, there's economic depression. As government rule says, maintain the 2 gaz duri, so physical distancing, quarantine for 14 days. Then you have a relatively updates are coming frequently, whether you need a 14 days quarantine, 21st day quarantine, then you can have a home isolation. There are different updates and knowledges from Ministry of Family and Health where then you have a media, infodemics, another kind of things, disease, you have a patient, healthcare professionals, relatives, take care, they have a psychosocial impacts and all these populations. So such kind of integrated relationship between disease, healthcare providers, family, government and populations. Then there are several stressors during the quarantine. First one is the duration of the quarantine, 14 days. If you live alone in 14 days, it will be very tough. So it's a harsh stressor. Fear of infection. If you are living with the family, you may think that your wife, your kids, your parents may get infected. So fear of infection. Frustration and boredom. You don't have much. You cannot go along with anybody. You need to live alone. So frustration and boredom. Inadequate information. Sometimes you don't have proper information how the things are going on. Inadequate supplies of various stuffs across the country. So these are the few stressors during the quarantine. And the post-quarantine financial crisis. Many of the people there, those who are dependent on their some means, they are in the financial crisis stigma. So these are the few steps of psychological impacts of the quarantine and isolations. Another very important thing that happens in this is especially technology in health infrastructure. As we don't have any protection kits earlier, people have now protection kits, sanitization robots, modified ventilators. Even as mentioned by the government of India, India was not in the process of making the ventilators. Now we have huge amount of the ventilators, and they have X number of supplies. So protection kits, sanitization robots, modified ventilator. These are the few advancement in medical facilities. Then the testing and treating procedures, RT-PCR test, it was very difficult in initial phase times. Now it has become and now we got the rapid tests as well. So advancement in testing and treating procedures. Another very important is efficient disposal of biomedical waste, because there are many kind of research has been started because of this COVID pandemic, and in terms of treating, how we can treat and effectively dispose the biomedical wastes. Another very important is technology in monitoring, how we can monitor the patient, or how can we monitor the hospitals continuously, whether beds are available or not, patients vitals, how they are performing. So technology in monitoring, especially big data analysis, geographical information system, and artificial intelligence, they have played a very important role in this pandemic. So mobile-based applications have gone pretty much high, like web-based dashboard monitor, where you can find out what's happening across the India or across the globes. Healthcare applications, tracking applications, like if you got a corona positive, your mobile, you will get a red signal. So tracking applications, conferencing applications, all kind of mobile applications has been developed during this pandemic. Artificial intelligence and remote sensing, people have used these tools of artificial intelligence using medical solutions to come up with this mutation virus genomes. Then you have a unmanned aerial vehicles, UAV, they are they have been widely used, giving the supply for the frontline workers in this pandemic. Then another one is a blockchain technology. So people are using the blockchain technology as well. Having said this about the book, I will give you some kind of case study, how this pandemic, how this COVID-19 is confirmed case was related to the climatic variables, pressure, relative humidity, temperature, and wind speeds. And this kind of study, I think is the first of this kind of study, these climatic variables, how they are impacting these confirmed cases, especially in the rural, urban, and in the total, across the 623 pandemic affected districts in India. So this data is relatively old. This data is up to June 14th, 2020, because recent data is under one of the publications, so I have not shown that one, but this current study is performed for 623 COVID-19 districts as on June 14, 2020. And we have taken the data for 103 days from March 4th to June 14th, 2020 from this website, where the data are available. And climate data we have taken pressure, relative humidity, temperature, and wind speeds for these same days. Census data we have taken from Government of India 2011 census, because 2021 census is still not available. So that data we have taken. Exposure we have considered for the child and old greater than 65 years, and child population 0 to 40 years. And vulnerability, how the people are, how many people are vulnerable in each of these districts of 623 districts, illiterate population, number of household in these districts, which does not have fresh water availability, and number of household which do not have the electricity and sanitation facility. Based on these data, we have some kind of analysis, and this all data we have got from Government of India's websites. So this is overall methodology. If I give in a relative humidity, pressure, temperature, and wind speed, we have taken the 28 linear combinations, and we have a confirmed COVID-19 cases from Ministry of Health and Family Welfare websites, and district by time series we have. Then we have applied some kind of modeling, basically exponential modeling, and we found out the best fit parameters. And then we computed three things: hazard, exposure, and risk. And based on that vulnerability, how many household with no fresh water availability, how many household with no electricity and sanitation facility, and how many people with illiterate population. So that kind of analysis we have done. Then this is the confirmed COVID cases across the India with different states and different districts. And these are the pressure distribution, spatial distribution, relative humidity distribution, mean temperature, and wind distribution during 2nd March 2020 to 14th June 2020 for 103 days. So once we have this data, we have carried out some kind of analysis of whether my district is a climate dependent districts or climate independent districts, and which type of the climate is there in that one. So what we have found out that in 133 districts of India, surface pressure was predominant. In the 80 districts, wind speed was predominant. Relative humidity was predominant in 74 districts, and temperature was predominant in 46 districts. So across the districts, which climatic variable is predominant, that we try to find out in this study. And the last one, which states in India has highly affected and which are the least affected. So we see here Kerala, National Capital Territory of Delhi, Punjab, Tamil Nadu, Haryana, and Uttarakhand. They are highly or mostly affected in terms of districts. Sikkim, Nagaland, and Arunachal Pradesh, they are the least affected in terms of the risk. So this risk we have done GIS mapping in terms of rural and in terms of urban. And then we have given the combination of urban and rurals. So based on each of the districts where we are located at present now, we can see whether we are in the low risk, moderate risk, high risk, very high risk, or extreme risk. So what we have found out finally, that rural population in 19 of these 35 states and union territories have at least 50% of their districts under high or above risk. It means this risk, this category, or this category. So 19 of the 35. So almost 50% I can say on that. Whereas the urban population of greater or equal to 50% districts in 11 states under such high risk classes. So according to the COVID-19 hazard measures with district-wise combined rural and urban population classes suggest that 50% or more districts in 19 of 35 states exhibited high risk of pandemic. So, and this, our conclusions are pretty much valid with the COVID-19 confirmed case. These are still going on. And we will soon come out the study with the data of up to 31st of December. Then we will have much more clarity how these things and their dependency on climatic variables. I think with this, thank you so much. And I will take again opportunity to thanks my all colleagues, especially Professor Anil Gupta, NIDM, and Dr. Akansha Tangi from Springer. So thank you so much.
Thank you so much, sir. As we all know that world will never be the same after COVID-19 pandemic. Sir, you will put out the point that how the COVID impacted psychologically it impacted us, and what were the other stressors during when we were having some quarantine period of 14 days after 21 and all that, and how technologies improved in the health infrastructure with the time. So thank you so much. Now I would like to invite Professor Ruben Kishorsa. He is a medical educator and public health expert. Did his secondary education from Jamia Millia Islamia. Has more than 250 research papers and publishing in journals and magazines and in Delhi's. He's authored 32 books and many chapters and pamphlets on public health, national programs, social reforms, and rationality. He is a recipient of Rashtriya Ekta Puruskar National Unity Award, Dr. S. Radhakrishnan Memorial Teacher Award 2007, and in 2009, IND President Appreciation Award in 2016, and also Chikitsa Ratan in 2016, Distinguished Doctors Award by IMA South Delhi, 6th Academic Brilliance Award for Best Faculty 2018. Dr. Jugal Kishore, sir?
Thank you, Fatima. Can you listen?
Yes, sir.
Everybody can. Okay. Thank you, Anilji and Akansha Tyagiji for this beautiful book has come out. I will not use any slide. The reason is that this is all what future is going to be predicted. We cannot be certain. Let's discuss about it. Anyway, NIDM is, conducting, I think, in the form of a disaster. In the form of disaster, you are doing or conducting workshops. It's so wonderful. People are so much gained because of these deliberation on various aspects. And I'm very happy to listen, Manishji. You have told about various modeling, and we also use the modeling for predicting the future course of the pandemic. But many a time we failed, and failed because of we don't have the data. We don't have very good and correct data because of that. But if we start collecting the good data, I think the prediction is all possible. That is what this pandemic is all about. Is telling, you rightly said that this is the benefit of this pandemic, that we are now realizing the importance of the technology and whether we can use it in a right way or not. So we are looking forward. I think we have to work together for many things, not only just pandemic, but other diseases. If we can predict, we can plan, the national programs at the government level. This pandemic, if we say today, we have almost 95.5 million people have suffered throughout the world, and 2 million people have died. Although we have records that more than this number is already died because of various diseases like the cardiac problem and respiratory disease, not because of COVID. And also the traffic accidents also cause a lot of problem. During this pandemic, India has also witnessed almost 10.5 million cases and 0.1 million. That is one of the lowest number of deaths. And we have to find out in future why we have low mortality and what are the parameters which are affecting Indians, maybe because of our, poor condition which are improving our immunity, or we don't have a good database, or maybe we have to find out the reason. But yes, this is a challenge for us, all public health specialists, to find out a good database. We all know the pandemic, COVID pandemic, has given rise to many deaths and distress, which is not counted till now. We don't know how much mental turmoil has occurred, but we witness, yes, it is there. And economic loss, again, we have very rough estimate, but we have to calculate how much economic loss has occurred. And GDP, you already know that how it has gone down. But what is more long-lasting bad effect would be that it has impacted the education and our work capacity. So in a long run, how this is going to affect our, the production or maybe the performance of the student, and how they will be brilliantly doing things. So it has to be seen. I don't know if we have such kind of study in future can be found out that what impact has occurred on education. But yes, the burden of disease, increased manifold, and the disease which are not handled by, health department because of the COVID, that is also a burden which is, extra was there. And this is true for any epidemic and disaster where health is also involved, and health sector is not able to handle all the problems which are there, or the health problems are there. And then we have the compilation, or say the repercussion of that disaster. Now, what is observed that manifold we have the violence, and domestic violence and gender-based violence that has increased during this pandemic. And that is again telling that when we don't have any work, or maybe I think we are confined to four walls, then human behavior changes, and that sometime maybe bad also for the people. Now, another problem which we have witnessed is the migration. That is not just as migration, but the human suffering, and also the mental suffering due to migration, particularly labor class, and leading to unemployment is a huge effect, the bad effect. So pandemic has many effects, and one has to calculate these all effects. And I think we'll be having very good understanding that how one particular disease, just one virus which is not even seen, can have the impact on the human life and also the whole globe. On other side, we say, yes, we have the benefits, like the people now realizing the importance of health. They know one infectious disease, but now they have inquisitions for other diseases. They are aware of now the infection is very important, and we should look the causes and also try to solve it. Then we have a concept of One Health has emerged out, that not only just human being, but we have to look into the animal's health, and all together has to work. Then only we can solve the problem. So the concept of One Health is emerging very fast, or multi-facet One Health is required. We have also realized that hygiene and sanitation is, a decades-long story of that. This is very important. And then once again, our Swachhta Abhiyan has proven that this is the need of the hour, that we can control infections and many diseases just by hygiene and sanitation. Even 60-70% of our diseases can be controlled. So that is the realization. If people can realize, I think this is the best time that this need to be done. Then this is also found that if we stop everything, then pollution also not there. So in 2020, we have seen that there was no air pollution, no water pollution, many things were not there. So means that these are the human activities and human things which are creating problem and producing a lot of pollution. So we have to change our activities so we can have less pollution. That is the learning. So this is also quite evident. We have seen that road traffic accident has decreased tremendously because road were empty and we had no problem. So pollution and trauma decreased manifold. And there are studies showing the interpersonal relationship also improved. So in physical, mental, and social, all domain, there was benefit of the pandemic in terms of realization that we can improve further. We can understand now the factors which are impacting our life is well known. This new lifestyle is also emerged out, which was never thought of, that we are having this, online classes, online, webinars, which were not common. But today we know that this is very, very, useful thing, and we can, improve this medium of interaction in much better way. So the transport, or say the movement, can decrease. We can safeguard those all things. So that is what I looking, the benefits of it. The work from home, we can have 3 days or 4 days, and 2 days we can have work from home. So that way, decrease the stress and many things. Also, online classes, in adverse condition, we can have online classes. Otherwise, we can have school, open up. So these are new things which has come out, and I think they are very useful, and they have to be utilized in proper manner in future. And Manish has already said that about technology, that how technology developed, how we are utilizing this technology, and we are looking forward. The scope is increased. So that is the beauty of the human mind. That is what I really wanted to say. But when we say about the future, so future is telling that we are facing emerging disease. All pathogens are dangerous, and there are mutations going on. So we have to prepare ourselves to handle those all infections and diseases. So as a society, we have to see that emerging disease is a reality, and we must look into it. The environmental degradation and also the climatic change, which has witnessed for last 10, 15 years, are showing that we have to make change into it. So that is the future, which we should work on. And that is the reality. Another one is that COVID-19 is also telling that, we have the V strain, G strain, and then G again have the many strain like the GR or GH or GV. They are the new strain which has come from UK, and then is spread to whole world. So that is what is actually telling that we have a concept of herd immunity, and this herd immunity can be challenged by mutation. So if we have epidemic or pandemic, and if we have mutation, then the concept of herd immunity is not there, and then again we have to look into, and that is why the development of vaccine is very important. So future has to have the technology which can have these kind of vaccines available much faster. And that is what we have learned today, that if need is arise, then human being is capable of, or our scientists are capable of producing vaccine within a very short period. I think in future we will be able to even produce within a month or two. It's possible. So that is what this future is telling, that maybe we will be having very targeted, very safe, and very effective vaccines in future. Now another one is that how we can decrease the side effects of the vaccine, that are also learned. Now the way on Saturday our program has been launched of the vaccine, this is also associated with COVID or even. So everything on app based, and side effect can be monitored. So these all things has developed. They are very beautiful development. I will say that if we can utilize them properly, I think in future we'll have more tracking of the side effects and adverse effect of the vaccines, and we can decrease those all things. what is not done properly is the misinformation and fear. So this is like the area where we have to work in future, that how misinformation which is created over a period of time because of, vaccine or infection or maybe mutation. So we should be able to handle it and disseminate it in a proper manner. So we require communication, the risk communication strategy, which can be learned from our disaster colleague, our disaster management colleague. The knee-jerk reactions like the lockdown, which has shown that yes, it has the effect. So it should be in future, maybe having very short lockdown. So we are looking at how now the administration is going to have lockdown in future if we are going to have such kind of problem. So that is the future strategy. Then social distancing, mask, all these things has become the commonplace, and now we are realizing that yes, we require more and more use of mask, and people are using it and they are feeling comfortable. So if we have this practice of hygiene and sanitation and mask and social distancing, I think we can decrease a lot of problems. So if future is also telling that such kind of strategy has to be adopted in all the types of epidemics or pandemics. Frequent vaccination is also required. So we have to learn, the better and safe, and maybe I think nasal or some other method of delivery of the, vaccine is the need of the hour. What is lost opportunity in this pandemic? I'll tell you that I feel that there was a opportunity of tobacco and alcohol, ban, or maybe reduction of the use of the tobacco and alcohol, which has not occurred. Actually, it should have been. We have got very good time of 1 month, but unfortunately not able to, do that. So people should have left that habit, because there was a, time when this could have been done. Another one is that development of infrastructure. That is the lost opportunity. We have developed a temporary structure, a temporary, system, but this could have been used to increase the number of beds or ventilators or many things. I think that is the opportunity gone. If this would have been good for our country as far as the health infrastructure is concerned. And then strengthening of the IDSP and surveillance, which should have been the opportunity which could have developed, but it is also not done. The capacity building is going on, and this is the best time. We could have trained many more people. The hand-on training on the pandemic management and contact tracing and these all things which has been done by the people who are not actually the health staff, like the teachers or policemen. So the more and more health worker could have been created, and put on the work, and we could have trained more epidemiologists and management gurus in this area. Then orientation to development, the sustainable development. I'll say this is the very good opportunity for us to tell that yes, this is the time where everybody should start thinking of sustainable development. So that is what I wanted to say about the benefits, losses, and then future course of action and what lost opportunity we have got. Thank you very much, Amin. Fatima, you're finished. Thank you.
Thank you so much. We know that pandemic has impacted the healthcare sector the most, as you were working at the front line. So yes, it has increased the domestic violence, migration, and how we can control some diseases with the help of hygiene and sanitation. Sir, I'm just having one question. You were talking about the misinformation and fear. Just one thing: how are we supposed to how whom we will be responsible? Who will be responsible for avoiding the spread of this? Like we are having speaking of myself, when is the time of vaccination, some are saying that there are some allergies going on, so we cannot take the vaccination. So just one question: how can we avoid, and how can we know that this information is wrong?
Yeah, this is not only your question, but many of the doctors even asking us, should we go for vaccine or not? This is the human nature, that whenever new things is there is always a hesitancy to accept any kind of behavior. Behavior is like accepting the vaccine. This is more personal. So you always, weigh the benefits and the problem. Unfortunately, the problem is very less. Like, out of 2 lakhs vaccination on the first day, we had only just 50, 60 side effects, or say that, which is quite common, and which is even not even 0.1% or 0.001%, something like that. So you can imagine that this is highlighted in newspaper, and the people are reading it, and then they get the message that they have a problem. Even one problem is like a big problem. That is a known as a risk communication, which is not done properly. So we have a problem of proper risk communication for the country. If we can have it, I think we can reduce further. And we have so many media channels which are always good because they are presenting different aspect of the. But we require education of assessing things. Our education is just believing on things, but we should have analytical process which should occur to our youngsters and every human mind, and able to judge, able to take decision. We have a very poor decision making capacity. So that is what require, our education system should be such that it should have the life skills education, like the decision making, critical thinking. These things are not there. So I personally feel you should go for it. The reason for this, that why you should have the vaccine, because whole world is having the vaccine and we don't have very many number of side effects, and the human beings are having variety of genes and composition. So you have minor problems which could be just your reaction, or maybe pain or fever. That's fine. Ultimately majority are getting benefit. Majority, like 99.9% people are getting benefit. So you are why you are saying that I am just 0.1, I am the part of it. Why you think that way?
Sir,
Blame the public health.
yes. So we do. Thank you, sir. Thank you so much. Thanks for clearing all this out. Now, I would like to invite Professor Santosh Kumar, who is at head of department G&I, DRR, and CCDRR NIDM. He was formerly director SAARC SAC Disaster Management Center, executive director IC National Institute of Disaster Management Specialist, the World Bank professor and head Disaster Management Center, HCM RIPA, Jaipur, Rajasthan. A disaster risk reduction training and capacity development expert with 25 years of experience in different positions in the development program and DRR sector. He received professional training in disaster risk management from Israel, back with international work exposure at the World Bank and the intergovernmental body of SAC. Professor Santosh Kumar, sir. Good afternoon, sir.
Thank you, Fatima, for it. I hope I'm audible.
Yes, sir. Yes, sir.
Thank you very much. Giving a elaborate introduction of mine. I don't know how much I deserve, but anyway, thank you very much for this. I wanted to say, Dr. Ruben Kishorsa, अगर आप मुझे मुनमैत करें तो मैं भी अपना आगाज करूं. The meaning thereby that the whole world is talking about vaccine, and vaccine has not been able to trust the individual so far. Meaning thereby, as you can say that yes, that vaccine has many kind of side effects, but not very serious kind. This could be good for understanding of a doctor. They understand the implications, even if that small cough is there, that people get worried. I was addressing the other day of a group of doctors of entire Uttarakhand, especially on vaccine distribution. So I would just share and I get your response on that. But I will also add on that what is been given the task which Dr. Anil Gupta has given me to actually work on. So two things. One is this that in the process of vaccination, even if one or two case or casualty by maybe another reason, if a person is vaccinated, suppose X is vaccinated and dies other reason, not with the vaccine, but it will get kind of a exposed that the person has died because of the vaccine. So as I was reading in the newspaper, 55 people have already reported complications. And the vaccine which has happened in just today is the third day of vaccination. So how to actually that the communities who are engaged in the vaccination process can build the confidence and bring down the trust of vaccine and also the people who are receiving. I know there is no danger in it because vaccination process itself is very cumbersome, which goes through a different kind of a process. And actually, one information which went on all through that the third test of the Bharat virus has not been done yet. And even after that, efficacy is not there, but people receive that message, and that is moving faster in the world. That without any third test, and government of India has started this kind of a vaccination process. By the time you demystify about that is nothing to do with the third one, and although even if it is not done, it is good, you can take. So this is a challenge which maybe I can finish and then with question answer session. Dr. Jugal Kishorji would be highlighting this issue.
Yeah,
If
sure.
going somewhere, then we can and then otherwise I can finish.
I'll quickly respond to your
Okay.
question. Your
I'm not able to hear you.
hello, can you hear me now?
Yeah.
Yeah. Normal phenomena, quite normal phenomena of doubting things. And as we are becoming more educated, so the lot of information come from here and there. But the problem is that people are not public health specialists. The vaccine is a public health tool. It is not an individual tool. It is not given as a medicine. Therefore, they do not understand that if 99% of the population is becoming, protected, so should we take this one or should we not take because 1% is having complication? So it is the public health issue, as a public health, what you think. So you will always go for no, okay, fine. 1% will tolerate the risk because if we do not have vaccine, I think many people will suffer and have the complication, all that. So you have to calculate the risk and benefit. In that, one must understand that the public health always think of a bigger population rather than individual. Now, I have already responded that 51%, 51 side effect has occurred, but this is not even 1% of the problem. The many people have received, but only just 51, and they are all recovered. So if it has become public that yes, the reaction is there, but it is not a serious one, so one should not worry about it. So that is also encouraging, to the people. And the third question was, after this, second trial, we have gone to the vaccine, and it has not even third trial. Majority of the drugs in medicine actually come in market after the second trial. The third trial usually occur, when they think that yes, this is required and you require approval from the international bodies. Then only we require third trial. Otherwise, after second, the medicines are out. And long term, we know the effect, and then it was cut down or maybe improved further. But this was the emergency use, that if we give the people, are they going to have the effect or not? And internationally, we know this has not occurred in India, but outside we have the third trial we have already got the result. And that is why, the approval was given by the ministry. Therefore, should we wait or should we do it faster? You can always say that there is a politics and many things are there. That is another issue. But as a pure scientist and pure public health specialist, you have to see that whether this is a practice first time occurring or it is keep occurring. You'll find that no, this was actually not a new techniques or new, practice which has been done this time. It is already done for many important drugs like the HIV. We had the various drugs which were not even 100% effective, but still we are using it, because they are sustaining the life. At least you are increasing the life. Here, this is going to protect you. That is why I think you understand that, in public health, we do these all things.
Thank you very much, Dr. Jugal Kishore, for giving this very informative this and audience and to us also. Now I will just briefly touch upon what we are talking about today. And I was going back through the literature when I was requested by Professor Gupta and also Manish regarding this writing paper on related to this economic impact. And I looked at this what happened in this 2018, in 1918, and what was the practices when the happened. And I did not find anything different than what we are doing today, even if after 100 years of passes. That during that time, people were maintaining social distancing, people were into lockdown, people were using masks, and people were not having any vaccine. As now we are also did not have any vaccine till the this 15th of January in India, but outside India, yes, it was there. And this all led to what you said, that kind of a confusion, this kind of uncertainties. And this uncertainties led to a kind of a fear of death. And those fear of death, we say that people take a rational decision. And so that rational decision took that once the government decided about the lockdown, thinking that probably it has worked in 1918, so this time also it will work. So it worked in saving lives with the people. But on the other hand, it had the larger implications of economy, because when people were in the lockdown, then it's not no kind of a work was there. So whether there's leaving one sector, agriculture sector, all other sector collapsed very, very kind of in a huge way. I was looking at this, the kind of loss. This, and you see the World Report also when we were writing that time, we were making projections, looking at the different reports of the World Bank, World Economic Forum, and also International Monetary Fund, the UNESCAP. And then we were making a kind of assessment that how much kind of our economy would shrink. And definitely even what we estimated, it has shrunk much more than what we estimated while writing this paper. So global economy, they lost much more in terms of, if you see that pre-COVID time, that time alone, the world was losing large number of GDP, most of the economy were slowed down. And in this slowdown, this affected badly. So even today, when we say that V-shaped recovery, it is not happening V-shaped recovery in many of the countries. United States of America has put up $3 trillion. The Trump administration has put up $2 trillion of recovery package. The John Biden has recommended for $3 trillion. They were saying that 1 trillion was much less. 2 trillion was much less. So similarly, India came with a Atmanirbhar package of 20 lakh crores. So seeing this as a kind of how much stimulus it brings, and you see this, the example you all, Manish also quoted, Dr. Gupta also quoted, and Professor Jugal Kishore also quoted, the economy is not working well, and large number of unemployment, and the cascading effect of economic losses is happening, large number of suicide, large number of people. When we are looking at the child-centered disaster risk reduction, the data which we are getting, large number of children are out of schools. A large number of children are having trauma. Large number of women are into trauma. So the cascading impact, the social impact, economic impact, and also that kind of economic impact is very, very high. So in this kind of a pandemic, as Dr. Jugal Kishore mentioned, that next time we can do without unlocking. And many countries have done this, like Japan has done. They have a very partial unlocking. Taiwan could do the unlocking, very limited unlocking. Singapore could do the very small phase of this. Vietnam did a very small number of, but every country, 193 countries adopted this lockdown. So lockdown with this large number of research and global community have spent large money, and they have shown their solidarity in bringing that vaccine into the fast track mode. And many rules, normally vaccines, I was seeing that vaccine takes 3 years or 4 years or even 10 years of time coming to that. And this vaccine has come up in a very, very short span of time. One, that hats off to the research community that they have worked it so well globally and brought this vaccine on the floor, and people are not getting the benefits of that. The second question which I would like to highlight, that if you see the analysis when this February, the month of February, and it was breaking out, we have to look at this, and if we are preparing for the, say, we can, God forbid, but we say that if any another pandemic of this scale, because we did not know what COVID-19 is, how mutation behavior would be. And we are seeing in the wild management of this also, we had this new kind of mutations which found, and we said that it is a kind of a second wave or the third wave of kind of a so in this kind of a pandemic scenario, if we prepare and we wish to hold this economy, that economic down and where we keep functioning. So what kind of a confidence which we can bring into the people who are into the farmers. I remember I got a call from Bihar during that time when the COVID-19 was there, and that was a time of sowing. And the farmers were very eager to go to the field, and initially they were not allowed in the social distancing and COVID-19 lockdown and so on and so forth. But they said that they will do, and then after that government revised this kind of regulation, and government said that it is allowed, and by maintaining the social distancing, and see the positivity from the agriculture sector all across the country. Our country did not face any kind of a food crisis, and food security was there, and they had the plus 3% of the growth rate. But other sector, you see that manufacturing sector, construction sector, MSMEs, and all gone down. That led to a larger unemployment in the country and also outside the country. So globally, we said that in the connected world, supply chain disrupted completely. So export, import got affected. We were worried that how to actually restore. And if you see that every country is coming on a recovery package. So I would mention 2-3 points for the consideration. That when we say that emerging market economy is actually which is leading the global growth model also, because before pandemic, emerging market economy like India, they were, even if they are slowing down, but they were contributing in the global economy. But many developed countries, they are fighting problem. So now the confidence of what we are saying, that's all interconnected. If we do not have good public health system, this has been exposed this time, that if we do not have the public health system better, that economy will not perform better. So it's a symbiotic relation between each. They are interdependent. Second important thing which we found, that the confidence amongst the people have to be brought in. And that confidence would bring only when we have, we did not have during that time masks, we did not have sanitizer, we did not have any social distances practicing. What I'm saying is that the lessons learned of 1918 was not percolated down to the new generation after 1918. So those who, even after independence, 1947, we did not learn any lessons from 1918. After that also, that in the 74 or 80 years of kind of a 74 years of independence, we also did not focus on last kind of a pandemic. no global economy thought this kind of a pandemic would emerge effect. But I will always keep quoting, and every time I quote, I have quoted in my article also in that book, which Dr. Manish and Professor Gupta has edited, both have edited, that the World Bank epidemic report, which always highlighted that kind of a nature of pandemic, warning that loss of $3 trillion global loss to the economy might like to take place. So what I'm saying is this kind of a study, research or predictions, what the scientists they are doing it, they are studying, um, epidemiologists, they are working, how that not getting accounted for in the preparation of public health system. And the another workshop which we did in the in the webinar, Principal Scientific Advisor of India has mentioned that pandemic, public health, and disaster management should be brought in together. Like you see that during the pandemic also various disaster is also happening. So one, that economic cascading impact of pandemic is very high, and also other disaster is taking place that is also multiplying the challenges for the recovery. So that also leading to the further increase in pandemic. Third is that also happening, the large number of political activities also goes on. Side by side, religious activities also goes on. And that political activity, meaning thereby elections and others in a democratic process, you have to see all these that the large number of people are getting together. So if we are making such kind of a system where the economy can also keep moving, people are also not getting affected, and now that how much this now the vaccine has given another confidence. So how such kind of a research is protected and research is also promoted, and for that as a kind of a global community should come as a one community and work together. Self-reliant is one, but we cannot think of we cannot think not actually depending on other countries' capacity as well. So this is also for strengthening or empowering our own countries. This kind of a support is always needed from one country to another country. Like COVID vaccine itself is a big case, like in Moderna or Pfizer, or if you talked about this India's vaccine, Covaxin, all there. And even if India is suppose in future thinking of all five vaccine composition of all five vaccines to be distributed, if we depend on one type of vaccine, probably will not be able to reach out to all the 130 crores of people. So maybe the mix match of those vaccines together, and then accordingly our supply chain, our transport system, vehicle system, storage system have to be designed. If all these done together and brought in together, well, that's what we have highlighted in that also, then probably we can have the confidence and of the larger community, and they will get engaged into the economic process also. We need to define that what is the rational behavior and what is irrational behavior. So if anything goes wrong, that people take that messages from the wrong things than the right thing much more. So that demystification and also de-warning. If anything warning we are giving, in the process of de-warning should also be there. So that probably would help in terms of last but not the least, I would say that we have found a serious gap in database management in this time also. And even if we wanted NIDM, we wanted to make a research and making a priority, whom should be given this kind of a vaccine first. And we wanted to have a mortality data that in 1.5 lakh of people who have died in India, who have died, which person, male, female, which age group, whether they're having kind of a comorbidity, or we are generalizing what is happening across the globe, that is also happening in India. So that kind of a generalized approach we are taking and taking as a gospel truth, and probably we are also acting on that. Or we have done that exercise already on the basis of the morbidity and mortality rate in India, so that this kind of a data is available in public domain, then definitely the projection would be much easier. So that's what Dr. Ruben Kishorsa also said, that many modeling failed this time because the behavior of this particular this virus was itself was unpredictable. Every 15 days it was changing. So if the problem is unknown, then solution is also unknown. If problem is known, then solution we can try. So with this, I would close. Dr. Manish and Professor Gupta, Professor uh, uh, and all the panelists, Jugal Kishore and Fatima, it is over to you now. Thank you for giving me opportunity.
Thank you so much, sir. Thank you for sharing us such valuable information. As we all know that COVID-19 pandemic impacted globally, but it also changed our daily lives. So, sir, yes, it impacted economically. Yes, like it has taken us some, I don't know how much years it had taken us back, because we went so back, like our economy get affected, and that too a lot. Now I would like to invite Ms. Akansha Tyagi, who is a commissioner editor with Springer Nature India Private Limited. She joined Springer in October 2014. She has responsible for acquiring and developing books in life science and environmental science from authors and institutions in Asia. She works closely with book authors to develop and refine manuscripts which have long-lasting impact in scientific and publishing community. She especially welcomes book ideas that brings our latest trends and enhance audience academic experience. Ms. Akansha Tyagi, ma'am, please.
Thank you so much, Fatima. And I would like to thank to all the panelists, especially Dr. Anil Gupta, Dr. Manish Goyal, Dr. Jugal Kishore, and Professor Santosh Kumar. So COVID-19, as we have already heard from everyone about their diversity of views, it has actually proved to be a global disaster, which was not just a medical issue, not just a medical disaster, but it impacted us economically because the whole world came to a standstill. And also there were impacts observed, and as mentioned by the experts here, especially by Dr. Jugal Kishore, that it impacted human behavior as well. Psychologically also we observed that there were several issues that all of us faced during the lockdown phase, and several social economic dynamics also changed during this time. To manage a disaster of this scale, I feel a very important criteria and very important factor is to be able to communicate with responsibility. During the time of any kind of a disaster, it is important that we are able to communicate within the community and share the information with responsibility. And with this idea in our mind, we started a book series with NIDM a couple of years ago in 2019 with in the leadership of Dr. Anil Gupta. This is called Disaster Eco. It is basically centered on the ecological health and sustainability principles, and the series is based on the disaster resilience, keeping in mind the environment and the ecological factors involved. So we were not actually aware in 2019 when we started this series that we will be hit by a global pandemic the very next year. But that happened, and I remember having this discussion with Dr. Manish Goyal and Dr. Anil Gupta that now that it's a new series, and we are already in the middle of a disaster, it makes sense that we bring out some content which not only just narrates the scenario that the world is facing right now, but also offers some solution. So in the light of this novel coronavirus outbreak, this idea was discussed back in July, August 2020, and I was happy to pick this idea up in my role as a commissioning editor with Springer and publish this in the form of a book within this book series, which was started in 2019. So this book basically, it provides an integrated assessment of COVID-19 like pandemics. It also discusses other pandemics and try to assess that how are other pandemics related to COVID-19 and what kind of a risk assessment can be done or which has been done earlier for other pandemics, and what are the lessons that we can learn from those situations. It also addresses, of course, the medical facts of the outbreak, but it just doesn't limit itself only to that. But there are discussions on the social, environmental, and economic impacts of the outbreaks in various sectors. So much so that we also have covered the resilience analysis towards biodiversity, towards ecosystem services, and agricultural food production as well in this book. And as I mentioned earlier, that it takes lessons from the historic outbreaks and provides what the key strategies that can be used to deal with similar situations in the future. And as a publisher, we are extremely proud and happy to bring out this book because it is not only relevant for students or academic community, but at large for the scientific community, for policymakers, for professionals in health sector, in environmental sector, and anyone associated with disaster and sustainable development as well. So, and I also want to take this opportunity to talk about what Springer did during this time of pandemic. We were aware that as an international academic publisher, a lot of scientific community is actually looking up to us to provide our support in terms of the latest scientific developments, information sharing, and providing the solutions. So we made all the content available with Springer, which is related to COVID-19, free access. So throughout last year, the entire content on the Springer platform, which is related to COVID-19 in some form or the other, was made free access, so as to facilitate the researchers to get access to information and support their further work. We published something around 25 new book titles on COVID-19 related aspects. They were spread across different disciplines, some in economics, some in agricultural sciences, some in, of course, medicine, some in, related to viral taxonomy. So we basically touched upon the whole, in a very holistic way, what all is happening in the scientific sphere related to COVID-19, not only in the books, but there were some special issues published in 15 of Springer journals. We in fact created a dedicated portal on the home page, where anyone who comes and access the Springer page could go to that portal, and all the information related to COVID-19 was presented there. Just like today's session, there were several sessions which were organized throughout last year, where we invited experts talking about COVID-19 and how this disaster can be managed well. Overall, I feel that as a representative of publishing community or media or information sharing and exchange world that I belong to, I feel the solution to a problem which is so complex and so globally relevant, just like COVID-19, can be found by using 3 C's, which is, the first C is having a collective and coordinated action. I think we demonstrated as a country and globally also, when there was so much of information exchange happening, although it did have its own flip side, but within the scientific community also, a collective exchange of information, collective research, and finding solution to the problems in a coordinated way involving all the stakeholders is one of the approaches that helps us in overcoming the problem of a global pandemic. Then the other C is effective communication. As I already mentioned, that we as a publisher took some steps, and we demonstrated that how information exchanged or communication which is exchanged in an effective manner can be helpful in finding solutions. And of course, the last C is cooperation, which again it goes without saying that without any kind of disaster cannot be managed in isolation. So all the stakeholders need to be coordinated, needs to have cooperation and communication lines connected with each other. With this, I would like to close my remarks here and would like to extend a big warm thank you to NIDM and to all the panelists for inviting me and for hearing me out. So thank you very much, everyone. Thank you, Fatima.
Thank you so much, ma'am. Thank you for sharing your experience with Springer and have you managed to do the like a community with communicate with the community and about the SF about the 3 C's of collection and coordinating action, effective communication and cooperation. Thank you so much, ma'am. I think we may be having some other series with like in this discussion. We may be going some other series hopefully. So before going to the before having the valedictory session, we just are having a question from participants. We're saying that yes, he's saying that can you please throw a light on changing role of social researchers post COVID as the marginalized section of society already in anxiety concerning virus. So how social research researcher overcome this limitation, especially when using quarantine. Qualitative research technique. Anyone in the panelists can answer the question. Hello, Manish sir. I think you can answer the question.
This question is too long and it's not clear me what he's asking basically. I'm not getting the question. Could you please explain to me? I can answer something.
Could you please throw a light on changing role of social researchers post-COVID as the marginalized section of society already in anxiety concerning virus? So how can social researcher overcome this limitation, especially when using qualitative research technique? You know what it is.
Manish ji?
Yes, sir.
I think the question is very relevant for this transition phase also. Like we have varying kind of observations. Like in some of the states now we see that the new COVID cases are very less. Like in Delhi now, recovery rate is also very high. But there are certain pockets in the country where again the COVID cases are coming. New COVID cases are coming suddenly. Yesterday I was watching, and in some place around 600 cases were reported. So basically the social behavior, and I would say social behavioral pattern, that is also playing a great role. As people are unlocking their activities, people are sometimes suddenly coming out. Like what happens that when the new cases rate of new cases goes down, people become overconfident and people come out with and then stop wearing mask also. So I think these kind of things are very much related with your behavior and how you behave. And then what happens? Then many people start coming in the masses without mask. Then many people they get infection, and then there is a news that again there is the rate is very high. Then people again start using precautions, and then the rate will go down. So there has been a swing past 2 months, and place to place. Delhi also very high prevalence of the cases. Then government impose a high level penalty if one doesn't wear mask, and then all policemen were there, and then that it percolated to people's behavior. And then now gradually we see that some people now we have started seeing that without mask. I'm not talking of this webinar. Otherwise also.
No, sir, we are at home. We are at home or in the office.
So otherwise also this has started. Like so I was talking to some people in Gujarat, some friends in Gujarat on the day of Kite Festival, a day before Kite Festival. They told that here, in fact, if someone comes out with a mask, people look at him as an alien. Now they think that what is Corona? As if there was no COVID. Then what happens that when people are careless, then something will happen, and suddenly new cases will come. Then all of a sudden, all will start wearing masks. So how to capture this behavioral pattern. Some social research methods can be useful, and maybe like focus group discussion or something, that how and then lot of positive sides also from the social dimension, because COVID was something which has actually disintegrated the society. People stopped meeting their friends, and there are a lot of psychological and trauma that has greater impact, as Professor Santosh was also referring to. So I think and when particularly when we are not able to obtain quantitative information, then how to assign some quantitative value to the qualitative estimates. So that can also be
I think, sir,
dimension.
I can add something now.
Yeah,
As a social researcher, you have some qualitative data or you have some quantitative data. So you can go ahead and use the probabilistic approach in order to model these kind of scenarios. And if you have only qualitative data, then you can develop some kind of fuzzy approach. And on that basis, we can develop a model, and then these modeling phenomena can happen. So probabilistic approach and the fuzzy approach, we can use both of them as a part of social research. I hope this is clear to I think yes, seeing, yeah.
Yes, maybe they are having the answer. So we are having just two questions more. I think the first one is for Ms. Akansha ma'am. I think this is for you. Is how paper publishing helps in post-COVID situation, especially in terms of awareness and managing social attitudes. And what's the best way to manage the crisis from the below at community level and depend less on the administration to direct our behaviors?
Okay. So I would start by saying that knowledge is power. To empower the community, to empower individuals, having the exact correct information is very important, and it applies to any discipline, any field, especially when it comes to a sensitive issue like a disease, this COVID-19, which has very high infection rate, which spreads very fast. And already we are hearing from different sources about different miscommunication and different myths which are related to this disease. There was, I mean, during the time when we all were in the lockdown phase and this was a new thing that all of us were experiencing, there were so many YouTube channels put forward by various sources which were not even authentic medical practitioners, informing about how to boost your immunity, how to make certain preparations for some immunity boosters and so much more. So this kind of a disease which reaches out, which can infect a vast majority of the population, can also become a source of spreading myths. And that is why I say that knowledge is power. To have it's very important that you have the right information with you. You don't start following these myths. And that is where the role of scientific communication comes in. So the more papers we have on this topic, and I would like to highlight that we, as a scientific publisher, I also experienced that there was a huge inflow of paper, huge inflow of literature that came into existence last year, because everyone wanted to say something or the other on this phenomena. But again, any kind of literature is not to be trusted. Something which is peer reviewed, something which is coming from authentic sources, which is published in reputed journals, is to be referred for understanding this complex disease and how it impacts, what all it entails, and how it needs to be managed well. So without any doubt, scientific articles and peer-reviewed research is going to contribute in managing the disease better.
Thank you, ma'am. Now the last question, I think Dr. Ruben Kishore, if he's here, sir, is just for you. Just please clarify, can humans become infected with a novel coronavirus of animal source? Clarify. Just need a clarification for this. Hello? Mani, sir, I think you can answer the question.
In my opinion, it's no.
Okay.
I am not a doctor, but as far while writing the book and while we read in so many peer-reviewed publications, I think it's no. But I think Professor Gupta or Professor Jugal Kishore is the right person to answer this question.
Sir, then please tell us, Professor Anil Kumar, sir, can you please tell us, clarify us, then this case, can humans become infected with novel coronavirus of animal source?
Humans can become
Infected with novel coronavirus of animal source. Kind of this thing.
animals. No, this has originated from animal only.
Yes, a bat. Yes, it was.
So animal to human, that is zoonosis. Zoonosis is a type of infection route, na? All the zoonosis is basically animal to animal infection. Sometimes it can reach to humans, like bird flu also. Usually it is from bird to bird, but there have been instances, not exactly in India, but in other countries it can reach to human also. So that is basically the zoonosis. You know? Like even swine flu, it started from a pig and then it reached to human being.
Humans.
So that can be there. That can be there. So even in other cases also it can be there. You know?
Yes, sir. So last question of the session is this: how can we effectively bridge the knowledge creation through research and policy implementation?
This is what we are doing. This kind of webinars or discussions. But yes, more systemic approach is required to capture the knowledge. That is very important. Like perceptions and other things are okay. But even if we are taking the perceptions, then what is the scientific basis of these perceptions? You know? Otherwise, knowledge. What is the correct knowledge? So that is important. So that is what the former the President of India, late Dr. Kalam also used to say, that knowledge society. The society should whatever logics or whatever advocacy we are doing, that should be based on scientific basis. Yeah. So whether that is based on some kind of modeling or some kind of a ground truth understanding, so then it can really work well. So for example, even vaccines also we are talking about. So when we have some kind of data, then we can have more effective arguments. You know? As then when Professor Santosh Kumar pointed out about that 1% and 99%. And then Professor Jugal Kishore explained that this is the kind of a community, the science of community medicine, that we go for protecting the masses. And then certainly there are always some kind of risks associated with major initiatives. Yeah.
Okay.
I think, sir, I can add something like data analysis, modeling, and then you have a focal interview, feedback mechanism, and then the dissemination like this webinar.
Respondent analysis.
Yeah.
Respondent analysis.
So in that way, probably we can have an effective bridge between this research and policy implementation.
Okay, sir. Thank you, sir. Now it's the time for validatory session. Now I would like to call our head, Professor Anil Kumar Gupta, sir, who is head ECTRM division. Sir, please give us your valuable remarks of regarding this webinar.
This discourse has been really very interesting. In fact, now we have we are planning a bigger discourse with the Springer Nature, where we will bring some international experts also, and some more authors who contributed in this book, who can briefly reflect upon the philosophy and the concept that when they wrote this chapter across various sectors. As a precursor, today's workshop has been very useful and informative. As this coronavirus pandemic, although it was a disaster and a health emergency, but it has given great lessons also, great lessons for future. Because as we discussed at the beginning also, even pandemics can also take different forms. Like 2 days before, I read an article somewhere that air pollution is even a bigger pandemic, but which is a silent pandemic.
Hmm.
I do not know, even electronic waste may be going to maybe another serious issue the humanity can face. Humanity may be facing. We need to anticipate. So the science of anticipation, science of proactive assessment or predictive assessment, that would be very important. And the kind of discussions we held today has been very useful. And we invite from all the participants their views and reviews on the book also that has been published with the Springer Nature, so that we can understand the usefulness and efficacy of the publication also. So with this, I extend my sincere thanks to all the speakers of this webinar: Professor Santosh Kumar, Professor Jugal Kishore, Dr. Manish Goyal, and Akansha Tyagi from Springer Nature, and all the team members who organized this important discourse: Fatima, Mr. Harshit, Ms. Pritha Acharya, Atisha, and all Sonal, all the members from NIDM and all IT support team from NIDM. Thank you, and have a good evening, and stay safe. Thank you.
Thank you so much, sir. Thank you. Now it's time for vote of thanks. So, on the behalf of National Institute of Disaster Management, I take this opportunity to propose vote of thanks to those who have directly and indirectly contributed to this webinar. I give a really heartfelt vote of thanks to our panelists who spent their valuable time gracing the occasion. Today, we have opportunity to hear your thoughts, and this is definitely encouraging us in our future events. Your thoughts have enlightened our mind and shown us a new path. Thanks to all the speakers for joining the occasion and sharing their opinions today. I would like to take this opportunity to thank our Executive Director, Major General Kumar Bindal sir, for his unfaltering faith and trust in us. So, with your constant guidance and enthusiasm, we have succeeded and originated many constructive events towards national building. A special thanks to Professor Anil Kumar Gupta sir, an idea, my mentor and guide, whom under I am learning many notions of organizing and executing programs. I would also like to thank Dr. Manish Kumar Goyal sir and Dr. Jugal Kishore, Professor Santosh Kumar sir and Ms. Akansha Tyagi for putting up with us and presenting in a large number to make this webinar a success and sharing with us their important finding and thought-provoking opinion throughout the webinar. I would also like to thank Ms. Pritha Acharya, who is coordinator of the program, for her support. I thank all of you for sparing some time for this. I thank my colleagues, Mr. Harshit Sharma, Ms. Sonal Binder, Ms. Atisha Sood. I take this opportunity to thank our participants for listening us and sparing their valuable time for us. Thank you so much. Thank you, everyone.
Thank you. Thank you.